of the minimally invasive procedures that I'm currently doing is called a Baxano IFlex decompression. What this particular procedure is for is patients that are really stenotic, that have difficulty standing and walking for any prolonged periods of time, or for patients that have radicular leg pain coming from tight framing. It can be used in a number of other incidences, but the most common is for leg pain and stenotic back and leg pain. And what the procedure actually is in patients that have horribly tight framing, both laterally in the framing, what we call the lateral recess, which is deep to here underneath the bone, and central stenosis, where you take a normal canal and reduce it down to a much smaller diameter, as well as you take a normal framing and reduce it down to a much smaller diameter, either from disc herniation, facet overgrowth, or ligamentum flavum, or other tissue overgrowth, including facet cysts. The space around the nerve becomes very limited. By using this IFlex device, either through an open procedure or through a minimally invasive tube approach using Metrix tubes, we're able to do less tissue stripping and what I feel is a more thorough decompression of that frame and lateral recess using a little IFlex decompressor device here. What I actually do most of the time is I dilate up down to the center of the spine, up to about 18 millimeter dilation, put in an 18 or 22 millimeter tube, free up the what's called the ligamentum flavum here, bite away a little bit of bone centrally and over laterally along the spine, giving me access to the foramen and centrally. And then I'm able to pass a guide wire around this facet joint where it's very tight, followed by a neural monitoring device to make sure that I'm above the nerve root, not below the nerve root. And once I've determined that I have safe passage of my guide wire out the side of the back, I then am able to pass this little cheese grater device along the foramen and actually visually watch under C-arm visualization the foramen being opened. And it's quite remarkable how we're able to open that up with just a few gentle passes of this decompression device. This can be used in conjunction in some patients who you're doing fusion surgeries on to help free up the foramen and decompress centrally. It can be used on patients that have developed tightness above a previous fusion. It can be used on scoliosis patients and patients with spondylolistheses or slips. The advantage of this over a standard open procedure is using a tube. I can actually do both sides through one tiny incision. If I have to do multiple levels and open up the spine, I can actually open up the spine yet just strip the muscle off one side of the spine, and I'm able to pass this using x-ray and using neural monitoring along both sides of the spine, so I'm not destabilizing it as much. The problem with doing open procedures for scoliosis patients and for patients with slips is making the scoliosis worse or the slip worse, and the way that you do that is by taking away too much bone along these facet joints. By using a minimal approach like this, I don't have to take away as much bone. I don't run the risk of destabilizing the spine as much. And in patients that traditionally a number of years ago I would have done a stabilization procedure from the get-go, and nowadays I'm able to do a procedure that frees up their nerve and at least gives them a chance to get symptomatic relief without doing a major fusion surgery on them.